Today's ICD-10 quick coding tip focuses on what you need to know about a new fiscal year 2024 tabular instructional note update impacting how bowel obstruction due to other causes such as malignancy or infection is coded in ICD-10. My name is Claire and I'm an inpatient coding auditor. In my coding tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. Prior to the new code updates for fiscal year 2024, there was an excludes one instructional note in the tabular index for code K5669, other intestinal obstruction, instructing the coder that for an intestinal obstruction due to a specified condition, the coder was to code the bowel obstruction to that specific underlying condition. Coding Clinic had published advice stating that due to this instructional note, whenever a patient had a bowel obstruction due to an underlying condition such as a malignancy, only the underlying condition would be coded with no additional code assigned to capture the bowel obstruction. New for fiscal year 2024, the excludes one note at code K5669, other intestinal obstruction, has been deleted. What does this mean for coding? It means that an intestinal obstruction due to a specified condition can now be coded separately from the underlying condition. The sequencing will depend on the circumstances of admission. It's important to note that the new coding conventions take precedence over the advice given in the previous coding clinic. Let's compare how a small bowel obstruction caused by peritoneal metastasis would have been coded before the update and how it should be coded now. In this scenario, a patient with a known peritoneal metastasis due to their cancer is admitted for treatment of a small bowel obstruction. Prior to the new code updates, we would have only assigned the code for the secondary malignant neoplasm of the peritoneum as instructed by the excludes one note that was found at K5669, other intestinal obstruction. Now going forward, due to the deletion of the instructional note, both the code for the intestinal obstruction and the code for the secondary malignant neoplasm of the peritoneum will be assigned and sequenced according to the circumstances of admission. In this case, the reason for the admission was the treatment of the bowel obstruction, making it the principal diagnosis, with an additional code for the underlying malignancy assigned as a secondary diagnosis. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up, and if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding!